As a pediatrician, I am honored to partner and care with families in clinic, and many of them speak languages other than English. Recently, a mom and her 4-year-old daughter came in for a visit. They speak Kiswahili, and we were discussing routine care options, including seasonal vaccinations. Mom expressed an interest in learning more about the vaccines, and she seemed a bit unsure about them. I was able to offer her additional resources in Kiswahili, and she told me that she had appreciated having additional information that she trusted in her preferred language. We know that trust in public health is as important as ever, and that trust can be strengthened through accessible information and tools. There are so many opportunities for this kind of trust building, from clinics to communities.
Unfortunately, there's a lot of uncertainty in the public health funding environment right now. Public health programs across our nation have been undermined by steep funding cuts. There's also uncertainty about the future of public health investment. As a result, many of the programs that create and share immunization education materials, including high-quality materials in languages like Swahili, are at risk. These childhood immunization programs and immunization coalitions are a cornerstone of family health and wellness in communities across the U.S. In addition to their role in health education, they also help ensure that all children, including children who are uninsured or underinsured, can access recommended immunizations. Over the past year, we've had the great privilege of learning more about how public health departments and immunization coalitions do this incredibly important work. We launched a national project to identify and collect examples of public health strategies that promote childhood immunization access for families, including those who prefer languages other than English. We learned about many incredible programs. Unfortunately, we also learned some of these programs have already been cut, and others are uncertain about the future.
We surveyed immunization programs and coalition across the country to hear directly from folks on the ground who are creating and leading innovation programs. Here's some of what we heard.
The public health team in Seattle and King County created Ultra Germ Fighters, a kid-friendly activity book with translated vaccine messaging to support caregivers during COVID-19. They hired artists for Find It pages, coloring sheets, and a comic written by their risk communication lead, while vaccine frequently asked questions for caregivers were authored by a health educator. To shape content, they held listening sessions with language ambassadors and community navigators to understand what would be interesting to kids, any images or topics that don't resonate well with communities, and what would caregivers be interested to learn. The Language Access Program handled translations and cultural checks, and partners helped choose languages and distribute materials through libraries, clinics, and events. To balance cost and reach, the team printed visuals in English and Spanish and included a multilingual, frequently asked questions insert translated into 17 languages, with a comic book available for download online in all 17 languages, making vaccine information accessible and trusted across diverse communities.
Immunize Colorado, a non-profit immunization coalitions, partners with trusted individuals and organizations within communities to promote immunization and increase vaccine confidence. Their Trusted Messenger program hires community-connected individuals and organizations to boost vaccine confidence by offering education and coordinating mobile clinics at culture events, food distribution, and familiar community sites. Trusted messengers reach refugees, immigrants, and language-specific communities through churches, markets, radio, WhatsApp, and more, often using culture-tailored translations. To foster trust and boost attendance, Immunize Colorado pairs vaccine access with meeting social needs like monthly mobile clinics at food distributions and the community baby shower programs that bundles immunizations with Medicaid, SNAP, WIC enrollment, childcare navigation, and early literacy support for families.
Right here in Philly, the Department of Public Health invited parents to focus groups to understand what information parents need about vaccinations that they're not receiving. From their findings, they created the Grow Up Guide, a clear, step-by-step resource that walks parents through well-child visits from newborn to teen years and explains the vaccine schedule and combination shots to reduce confusion. The guide features multicultural imagery and a resource page for families transferring vaccine records from other countries. It's translated into 10 languages. The team distributes these guides widely at health fairs, provider offices, and through community-based organizations using the guide to spark conversations, build vaccine confidence, and meet families where they are across Philadelphia. All families should have access to the information and care they need to support their children's health and well-being. We look forward to sharing these strategies and many more as we wrap up this project. And to continue this work, these programs need funding. Local and state governments, philanthropy, insurance companies, and healthcare institutions can all play a role in supporting the important work done by immunization coalitions and immunization programs. The most effective public health investments rely on sustainable and long-term funding. And if you're one of these incredible immunization programs doing this amazing work and creating these materials, we encourage you to share them with others in the public health community. There's so much we keep learning from each other. Together, we help make communities healthier and safer for everyone.